Educational training on second-generation antipsychotic medications for psychiatric and mental health staff nurses by Pamela Watkins, MSN, APRN, APM, HNP-BC. Introduction. The topic is of vital importance for mental health nurses to increase awareness, insight, and education for early preventive treatments for the goal of quality improvement in mental health care outcomes. Increased education is essential in preventing major complications that could lead to shorter lifespans compared to the general population. The reduction of life expectancy requires urgent changes to prevent early deaths. Improving the quality of services provided through educational training in a compassionate environment that promotes growth and change is fundamental in healthcare delivery towards quality of care. Background. The purpose of the educational training was to increase mental health nurses' knowledge of risk factors associated with taking second-generation antipsychotic medications in the serious mental illness population. The project's goal was to assess psychiatric and mental health staff nurses' knowledge of risk factors and improve health outcomes by promoting safety for positive patient outcomes. Background continued. The aim of the training is increased knowledge of risk factors for appropriate referral for early preventive treatments after an educational training intervention program. The goals included education for PMH staff nurses in the serious mental illness population for A, risk factors associated with SGA medications, B, symptoms of metabolic syndrome, and C, identifying areas where further training was needed. Practitioners must provide education to improve healthcare outcomes with the goal of health promotion through evidence-based practice research. Methods. The participants were obtained from psychiatric and mental health staff nurses working in the daytime on 6 psychiatric units. The training took place in the staff development room for approximately 30 to 40 minutes in February 2017, and the results were analyzed and completed by March 2017. The PMH staff nurses filled out a survey with demographic information and completed a pre-test prior to the training intervention. The intervention was a PowerPoint presentation that focused on risk factors, metabolic syndrome, and complication of SGAs for early referral and treatment. Methods continued. After the training intervention, PMH staff nurses completed the identical 15 multiple choice and true-false questions for the post-test to assess their knowledge obtained. PMH staff nurses completed an evaluation form to assess their knowledge of the delivery of the educational intervention. The tool used to evaluate the project's effectiveness was a 5-point Likert scale, which assessed the PMH staff nurses' understanding and delivery of the PowerPoint educational training intervention. The scale ranged from 1 strongly agree to 5 strongly disagree. Demographic results. 24 PMH staff nurses attended and consented to participate in the educational training intervention program. Demographic data for gender, age, race, ethnic origin, occupation, and years of experience as a PMH nurse were analyzed using descriptive statistics. Table 1 shows demographic data summary. The majority of nurses were females at 79%. The participants were 71% RNs and 29% LPNs. The majority identified themselves as Caucasian at 50% and African Americans at 46%. The participants' age ranged from 20 to 60 years of age. The majority years of experience was 1 to 5 years at 38%, and the lowest was less than 1 year at 4%. Table 1 shows the demographic data summary. Test results were as follows. The pre-test and post-test data was analyzed with each participant's overall score using a paired t-test sample statistics and paired sample test. A statistical significant change in knowledge enhancement among the 24 PMH staff nurses among after the implementation of the evidence-based educational training intervention was noted. Table 2 and 3 displays these results. The PMH staff nurses' knowledge of SGA, risk factors, and health outcomes to promote safety in the SMI population were measured prior to and after the implementation of the training intervention. The pretest mean score was 65, which ranged from 33 to 93. The post-test mean score was 83, which ranged from 67 to 100. The test scores revealed an 18-point increase in post-test scores, which indicated a significant increase in knowledge achievement. Table 2 shows the pretest and post-test paired sample statistics results. Table 3 shows the paired sample test results. Evaluation results. The majority of the participants strongly agree that the educational training increased their understanding of metabolic syndrome at 92%. The majority, 88%, believe that they could identify SGA medications after the training. The results indicate that 100% believe that the information would benefit the SMI population and strongly agreed that continuous education and training was encouraged by PMH staff nurses, which is displayed on Table 4. The 5-point Likert scale was analyzed using descriptive statistics. Table 4 shows the 5-point Likert program evaluation. Discussion. The findings revealed that PMH staff nurses lack knowledge related to SGA medications and risk factors associated with antipsychotic medication, as evidenced by an increase from pre-test to post-test scores. Further education and training is needed to continuously inform PMH staff nurses about the many complications of SGA medications. The SMA population must be monitored in clinical practice to ensure quality of care and mental health to prolong their life expectancy. The project identified gaps in PMH staff nurses' training and knowledge deficits, which must be addressed to ensure adequate treatment. Further and continuous education is needed for PMH staff nurses to ensure quality of care for the SMI population on a yearly basis. The relevance to clinical practice requires APRNs to deliver effective and efficient mental health care in the serious mental illness population. References are listed. Thank you.